Hi, I'm Seema Kumar. I'm the CEO of Cure, and once again, welcome to Tuesday Talks. We hold these talks here every Tuesday because we want to convene the people around the community around important topics that are, top of mind in healthcare, and also bring us together over, an informal conversation, a glass of wine. I'm particularly very pleased with today's topic that, this is, as you may know, March is Women's History Month. We celebrated International Women's Day. And throughout this month, we've been focused on women's health. And so it is my pleasure now to welcome up Gilan Megeed. Gilan, come on up. She's a principal at Deerfield. Please have a seat.
Thank you.
Thank you. Thank you for joining us.
Thank you for having me.
So I'm going to say a few words about you and then introduce what we're going to talk about. So you joined Deerfield Management in 2014. You're a principal at Deerfield Management and also as part of Deerfield Institute before transitioning into the medical technologies team in 2017, right? And before that, you spent 3 years as an epidemiologist at Decision Resources Group, focusing primarily on rare diseases and neurological disorders. And before that, you were an analyst at Children's Hospital in Boston, forecasting disease outbreaks and epidemics with Computation Epidemiology Group. And you've earned your undergraduate degree in cell biology and neuroscience from Montana State University, Bozeman, and you hold an MPH from BU. So today we want to talk about women's health. And women's health as it relates to women in the workforce, and how, as you journey through your health, not only as a professional young woman, but also as you go through life stages and life milestones, the women's health aspect of it does have an impact on workplace issues. So that's what we want to talk about today. So we know that women's health, brings with it specific areas of responsibilities and aspects that are very, very, very different. And so let's first talk about how it impacts women in the workforce and your thoughts around that.
Sure. So I think there's, women go through different stages in their life, and from being young, maybe going through pregnancy and starting a family, if that's something that you choose to do, and then through perimenopause and menopause. And I think what's unique about women is that we do go through clinically meaningful changes in hormonal balances. Mm-hmm. And those hormonal fluctuations have a clinical impact, whether it's on our ability to concentrate, on brain fog, on hot flashes, on mood disorders. And I think without acknowledging that and not dismissing it as complaining or discomfort, but actually acknowledging that it's a real clinical condition, we can then begin to appreciate what challenges we may be going through in different stages in our lives.
So, how does that impact, like, let's say you're at work one day. How does that impact, a woman versus a man in the same job?
So if you think about a woman, let's say 45 to 55, right? That's typically the prime of her work experience. A lot of times her children are older and she's able to dedicate more time to her work. But we did a survey. 4 out of 10 women say that they have menopausal symptoms that interfere with their ability to do their job. This was a very large 1,000+ women survey. Mm-hmm. 17% of women actually leave the workforce in that prime period because of menopausal symptoms. And they attribute it specifically to menopause, like hot flash, for example. Mm-hmm. 85% of women say they're uncomfortable talking about it in their workspace. Mm-hmm. And 35% or more said that they don't believe they'll get any support from their work if they brought it up in terms of needing support from their employers. And so it's real. Mm-hmm. I mean, we see, I think without addressing it, we're not going to see the proportion of women we want to see in senior positions in the C-suite, because if they're leaving the workforce at 45, 50, we're seeing a big drop-off there. And so again, I think it shows that this is a real problem that we're now beginning to have real facts behind.
So what do you do if you are, one of those women? Do you just basically stay quiet and then just put up with it, not, and show up like everything is normal?
I think, women have done a really great job over the past 10 years discussing topics that were taboo that are becoming less taboo. Example, fertility. Fertility 15 years ago was not discussed as it is today. And as a result, we started seeing more advocacy, more education, and we're now seeing better coverage, better benefits, better clinical solutions, and it all stems from being okay talking about it and not making it a taboo topic anymore. Urinary incontinence, we're seeing that right now. Social media allowed us to discuss things that were really embarrassing, and we can discuss it in a way that we're anonymous. And by bringing it to the forefront, we again start to destigmatize these conditions. And I think we're kind of on the brink of discussing menopause. We are beginning to see more and more startups for support of women, more advocacy, more education. But I think what's key is that the women who are experiencing it are likely more senior, and they're likely in a position where they could be more influential. And so I think we really need to, as a community, take that responsibility, because the more we do it, the more that we'll see, I think, in a few years, or even less, we're going to be able to adopt these solutions and support networks that will make a big difference.
So, we're talking about women in senior positions where we sort of got right into menopause, but let's rewind the clock, right, a little bit, and think about, pregnancy. And you also talked about fertility, and so first of all, woman is pregnant and still decides to continue to work, right? What are the specific problems and challenges that women face in the workplace?
Pregnancy, we can talk about pregnancy and maybe postpartum and split them up. Pregnancy, woman typically chooses not to share until they're 12, 13, 14 weeks if they do choose to share. That first trimester is often the hardest trimester. You're sick, you're tired, and what's interesting is that they did a study on miscarriages before and after COVID, and they found that during 2020, the number of miscarriages was down significantly, and they think it has to do with the amount of, fatigue that women go through in that first trimester. Women for centuries have been working the farms and manual labor, so it's not that we aren't able to do it, but there is something to say about, how can we be given some leeway or some ability to handle the symptoms that we're going through. And I think, postpartum too, it's, we're given a maternity leave if you're able to get one and afforded one. But then you one day you're on maternity leave and the next day you're full-time. And there's very little counseling on how to make that transition. And as a personal story, the first week I was back at work after having my daughter, I did not know how to pump and work. I missed meetings or I missed pumping sessions. And it seemed like a very basic thing. I just add to my calendar, I take a 20-minute break. It just, in reality, it wasn't that easy. And so we're now seeing companies like Maven provide specialized postpartum counseling, return to work counseling. A lot of companies have that as a benefit, where you work one-on-one with somebody for a couple of weeks before you come back in, or even afterwards. And I think it's really important because you're still going through hormonal changes, you're still adjusting to a new schedule, you have a full-time job plus a baby, and so I think we need to have.
Not to mention the emotional aspects of it,
yes,
right?
Yes.
You've just had a baby, you're attached to this, new member of your family, and then there is that feeling potentially of guilt, either way.
Either
if
way
you
you
miss
feel-
the
yes.
meeting and you're pumping,
or
you
or
feel-
you're not feeding the baby and you
or
feel
you're not
guilty.
feeding the baby,
Yes.
you're right, yeah.
And so I think the amount of mental health and postpartum mental health issues is big. And we're now seeing it, in the news more and more. And again, it's about taboo and about education and advocacy. And I think it's providing these support solutions and benefits. It's a way of saying that we acknowledge that what you're going through needs a little bit of help, and it's supportive of what we need.
So, this sort of gets into a little bit of controversial territory, right? Because for a very long time, we as women have been sort of fighting, for, an equal status at work. We want to be included in meetings. We want to say we're just as good as, men, and we continue to fight for that equality, which we're not there yet, right?
Yeah.
There's no parity still. Do you think, so we're sort of like how do you navigate this, where on the one hand, you're saying I don't want any special treatment, but on the other hand, we're saying we as women are different. This is not anything other than any other mental or physical, condition that you might have. And so how do you navigate that as a woman in the workforce, and what should workplaces be doing in thinking about this? Because this is, different and new, right? Post-pandemic as well. It's more light into this issue.
I think I think I felt the same way, and I feel the same way many times, right?
Yeah.
So how do you advocate for benefits, but not look like you're asking for too much? And that's a perpetual woman's problem, where we feel like we're asking for too much.
Yes.
I think there's, by educating about what really happens, you're able to define what's part of and I use the word clinical a lot because there are things that are clinical, and that your body's going through changes that really need to be given the support that you need, because we're human and we have these physiological changes. And I think if we acknowledge it as a human right, so if you're going through, you have the right for mental health leave, you have the right for medical leave, and so it's including it in the package of this is as a physical body what I need to support to continue.
Yeah, and the pandemic kind of brought a lot of things from, it was the most horrible time, of course, but there were a few silver linings, including the fact that it brought to light many issues that seemed, so-called hidden, including the lack of care infrastructure for women and the triple burden that women face when everybody was under lockdown. How do you feel about that, and what do you think are some insights from the time that we want to forget, but maybe there are some things lessons we took away?
As an epidemiologist, by the way, we never want to forget that. Lessons learned and how to respond. It's, again, like from a personal experience, I travel a lot, work from the office, and my husband works 100% from home. And we have a caretaker that comes home to our house every day to take care of my daughter, and if she has a question about her food, she calls me instead of going to my husband who works, right there. And so it's what you're saying, we always kind of take on that responsibility, even though, we try to dispute as much as we can. I think part of it is not being ashamed of knowing when your limit is met, and being really honest with yourself, with your family, and if you're able to and comfortable with your colleagues about what your limitations are. If you want to say, I can't do late meetings, or I can't do this travel, I think part of it is acknowledging what your limit is, because there is a ability to push yourself until you're kind of worn out or burned out. Yes. And so how do we avoid that, getting to that limit? And I think it's having real conversations with yourself. But maybe that's where the counseling helps, with the postpartum return to work counseling. It's being able to ask these questions.
Yeah. I mean, there is, for all other types of things, there's off-ramping and on-ramping, the back to work kind of a thing. So this, shouldn't be as different because your body has gone through a huge transformation and it's returning back to normal. And so returning back to work, there should be a transition plan, right?
And there's, I think, acknowledging that women go through all different types of labor and delivery. Some women I know were up and walking an hour after they gave birth, and another woman I know actually broke her pelvic bone, and she had to learn how to walk after 6 weeks. And so if you have a 12-week maternity leave and you were relearning to walk at week 6, how do we accommodate that difference? And how do we support that woman to remain in the workforce as long as she wants to?
Yeah. I mean, I think one of the words to underscore about what you're saying is the word clinical, because you're saying that there is actual, real biological, clinical changes that are going on in a woman's body that needs to be acknowledged. It's not that there's a special treatment or anything like that being asked for, but you have to acknowledge that there is something going on, both by the woman. But what about the leadership in a workplace? What should they do? What should they be aware of? And are there places that do this well?
I think the leadership should be willing to be educated. I personally believe that not everybody can be an advocate for everything, right? Like you know what you know, and you don't know what you don't know. And I think the key of being a good leader is being willing to be educated and to listen to others, and hence why I say we want an advocate, and then we want people who will listen. And I actually think that Deerfield did a great job about this. We went and we talked to management about better and more maternity women's health coverage, and they added Maven to this year, which specifically has postpartum return to office counseling. And so I think that there needs to be a willingness to listen, to be educated, and to maybe challenge your misconceptions about how something or how you thought about something. Just to give you an example of why we think about it as clinical, a woman's estrogen drop when she goes through menopause takes place over 10, 15 years. That same level, that same incline of decline of estrogen for a woman postpartum takes place in like 2-3 weeks. So a woman actually has a huge drop in estrogen in multiple weeks that she goes through what is considered menopause for a while. But that's a very aggressive drop. Hence why you have postpartum depression, postpartum anxiety, dryness and conditions like that. And so it's, again, thinking about it where it's a real change in a woman's body.
Yeah. I mean, maternity leave in some other countries, go for about 6 to 8 months sometimes.
Yeah, or 1 year even.
Or 1 year even, 1 year even, right? And so how do you, if you're not in a workplace that is very progressive in its thinking, how do you navigate this without seeming, like, you're sort of expressing an area of weakness or fear that, somehow your career may be affected as a result of this?
I wish I could say, oh, it's federally protected, so you shouldn't be afraid, but it's not always that. It's not always that easy. I think I don't blame women who are uncomfortable going forward, and I don't want to say just do it, because I don't think that's a practical solution or practical advice. But I do think that if it's something that, I think there are other ways to get involved. There are community efforts, there are legislation efforts that you can be a part of. And there's, if you do find maybe a group of women or a group of employees, men or women, who want to be supportive of something, sometimes it's easier to go as a group instead of as an individual. And so there's, I think, finding ways to have your voice heard. It may take a while, but I think the goal is to have our children have a better life.
Yes.
And that maybe helps put the timeline in a different perspective.
Yes. But speaking of children, right? I mean, so in between, right? So okay, your children are 3-4 years old. So you're not in perimenopause or menopause, maybe, or you're like over all the postpartum drop in estrogen, and so you're like, okay, now you're in cruising altitude, but then you've got like a 3-year-old and a 4-year-old at home.
Lots of turbulence at that point.
A lot of turbulence at that point, right? And so is it fair to say that, if for whatever reason, social, traditional, cultural, whatever it is, women end up bearing, a little bit more of the burden of childcare, right? Yeah. And they're the chief medical officers of the family. They're the chief community officers of the community, and so how do you handle that? And what are some best practices you've seen, in your experience, whether it's in academia, in industry, in other places, where women have what I call the care infrastructure they need to be successful in the workplace?
Yeah, I think, what I've seen, for example, a lot of companies are able to have a really healthy divide between work and family. And by healthy divide, I mean realistic working hours. And so, you're able to manage your schedule, you're able to manage with the flexibility that you need. I think flexibility has many different meanings. And I think in today's world, especially post-COVID, it can be a little triggering sometimes to some employers. But I think flexibility is key. And working with the employees and how that can work within your specific company. That may include working from home, that may not, that may include maybe different hours. I know some women who will work from noon until 8, or instead of 9 to 5, and if that's an availability and it works for them, that could be great. And so how do we create a work environment that allows people to blend their life and personal life in a way that is efficient? And I think the other thing too is, my background is actually Egyptian, and one thing that I've loved about the Egyptian culture is it does take a village.
Yes.
And it's ingrained in society there. And so how do you create your own village?
Yes.
And is it support from friends, school friends with the kids? How can your work be your part of your village? And I think having a conversation where it's not just about being a support of an employer and employee, but how can your office become your village and become an integral part of your life? And I think when we start thinking about it from that perspective, it just becomes a better conversation.
I was talking earlier this year with Indra Nui, the former chairman and CEO of PepsiCo. And she talked about how it was a similar thing, the Indian culture, the community, her neighbors, her parents, her cousins, her husband, everybody helped out.
Yeah.
She said, if I didn't have that sort of cultural infrastructure, including people at work.
Yeah.
Her 2 executive assistants were, some days she just had to bring the kids and they were running around the boardroom table. And she's like, it was just a culture, culturally, from the culture perspective, she had the support system, but from the work perspective, she had a village. And so she had people who were like, okay, let's take them away from the boardroom and off to the kids' playroom. And of course, there was childcare, facility there. But the reason I bring up that example is that, even somebody like her, who was a CEO of a large corporation, needed that care infrastructure in order for her to succeed. So it does take a village.
And so I'll say that a lot of companies, Home Depot, for example, has very low turnover for women and has one of the record lowest number of women who leave the workforce after having a baby. And one of the reasons is because they have full, free, provided childcare in the office.
Yes.
And they found it's directly correlated to how many women choose to stay in the workforce. And economics for each company is different, but that's a very tangible solution. And some companies could maybe work together if you're working in an office park. Like, could there be a daycare or childcare in the office park? And I think there are ways that we can definitely think about how to create a village in your workforce.
Yes, and sometimes some of it is available in part of the infrastructure. Some of it you have to create yourself.
Yeah.
Right. In academia, a long time ago, well, even up until recently, right, there was a whole tenure clock. And so if you left and went off, and had a baby and then came back, the clock was not stopping. And you would continue to go on. And by the time you reached tenure track, and you needed to have a certain number of publications and certain number of body of research advanced, you were behind because the clock never stopped. And just, like right before the pandemic, I think a lot of academic institutions came up, really decided to change their policy to stop the clock, so that if you're away for a year, that year or 6 months, whatever it is, that doesn't count towards your tenure track. So, there is a lot of progress, right? And yet there is still, I think the mind shift that you're talking about is the ability for women to acknowledge and for the system to acknowledge that, there are real biological, clinical things that happen in a woman's body that we need to take into account.
Yeah, and I think also that, with children, it's sometimes we tend to try to hide them, right? Like if we're taking a call from home, I want to make sure that there's no evidence whatsoever that I have a child, that you can't hear them, you can't see anything, and why is that? Like, I think it's, I'm not, I do the same thing, so I'm definitely not, don't have any solutions, but what can we do to not make children a taboo for women in the workforce?
Yes, that's an excellent point. I think to some degree, and I don't know if you agree with this or not, but at least during the pandemic, you had children, you had dogs, you had cats, you had, different people walking through the screen, and it was all okay, right? At some point, maybe that was some little bit of a equalizer, if you will. Couple more questions, and then I'm gonna, look to the audience also to see if we can start a dialogue with the audience. What should men be doing in terms of supporting women? I mean, they are our partners, especially in the ecosystem. So,
I think again, willing to be educated. Even my husband says that he never really appreciated what a woman went through until he lived it with me. Right? He saw me crying, trying to breastfeed. He saw like the pains of having a pregnancy. He saw like me trying to put together a weekly menu for my daughter while going to running to my job. And I think. And he's a great partner because he kind of took a step back and said, okay, I see what's going on that I never saw before, and so I think I think willing to be educated, and I think it's on us to a degree to work on the messaging of that. So I think that's number one. I think number two, there have been so many great new startups and solutions that are now coming up through this great ecosystem that women are building, and they're still not getting funded. Mm-hmm. And they're still not getting the attention that they need. And it's really hard to build solutions when you don't have the funding for it. And so how can we break down that mental barrier? Because even me as an investor, sometimes I'll get an email with a company be like, nope, don't want to go into that field, right? And I guarantee you that happens with a lot of male investors. And so don't say no. Listen, be willing to be educated that maybe the problem that you think was not a problem actually is a problem, and this could be a real solution for it, because until we get real funding for these solutions, they're not going to be available mainstream.
So talk to me a couple of examples of the kinds of innovative things that are coming up, because women's health, first of all, in general, like first of all, before there was an Office of Research on Women's Health at NIH, women were not even part of clinical trials, right? Because the exact clinical and biological condition that you're talking about messed up all the clinical trial results. So it's like, okay, just like put that away, right? Like, let's not include it. But now we understand that we do need to include women, and then focus on women's health has not been as you said, a commercially viable, fundable kind of a thing, but now we see some emergence of interest in this arena, actually led by women entrepreneurs and by women actually who are funding it. So what are some examples of some innovative things that we're looking at in femtech or women's health that you see are examples?
So we can start from things that are kind of truly mechanical. So the speculum, for example. The speculum is the device used during a vaginal examination. The speculum has not changed in over 100 years. It was the 1800s, and they were actually tested on slaves. And so we're using a device from the 1800s in today's world. And there's been...
It hurts to even think about it.
It really is. And so there's been a number of, and it's a very painful exam to some women, especially women who have been sexually abused or have sexual trauma. They do not go for medical visits because they don't want to have that experience. And so if you look at the compliance rate, it's a real issue. There's a couple of companies have come up redesigning the speculum. And one of them is different sizes for different women. Right now, we use the same speculum for teenagers and older women, which is very painful and maybe not even ethical. So, it seems like a very basic item, but when we try to look into how we could sell this product, convincing hospitals to all buy new speculums, and that budget item went to the very bottom of the priority, and we couldn't actually sell the product because it's not life-saving, right? It's lifestyle, even though you can talk about compliance, et cetera, but it's not a life-saving device. It's not a surgical device. It's not directly reimbursed, and so that's one category of products that we can't move forward because the reimbursement structure really isn't there for that.
Yeah.
I think one of the other ones would be kind of the digital solutions, the educational content. And that we're getting more traction because we're, as the generations are becoming more and more susceptible to digital solutions. I think it's a great time for, especially for menopause, because believe it or not, millennials will be hitting menopause in the next 5 to 10 years.
Oh my God.
Because millennials are now over 40. And so, if we kind of, I know we think about them sometimes, I'm millennial. And so it's the prime time these are people who are savvy digitally, are motivated to be self-educated, are going to doctor, having more questions, more real conversations. This is the time for these digital solutions to be really impactful. And I think we're seeing a lot of different companies pop up, but it's, we need to have the backing for it, both financially, but also clinically and through reimbursement.
Yes. Yeah. 2 weeks ago, we had a whole day or half a day, I should say, where, a whole bunch of physicians and other women came and talked about menopause and all of the progress being made there, because to some degree, traditionally, if you say you admit symptoms of menopause, and you're admitting your age, and in the workplace you don't want to be age discriminated either, in addition to gender discrimination. So that had been a hidden topic for a very long time. One last question. Anything that I haven't asked you about that you think is important for people to know?
I think sometimes we try to lump women's health into topics, right? And really women's health is about the condition of half the people in this world. And even menopause, we try to lump it into categories. But menopause takes place over, perimenopause and menopause over 10, 15 years. Some women have severe symptoms, some women breeze right through it. And I think we need to realize that there's diversity among how we experience different parts of our life. And the most vocal people tend to be the healthiest. It's not the people who need the most help.
Yes.
And I think that's opposite of some other conditions where the most vocal tend to be the sickest or need the most help. And so it's something that I think we really need to change. But I think we need to realize the diversity that is in. And so my goal, my hope is at some point, we don't use the word women's health anymore. We use the specific condition that we're talking about, because then we're actually that's the wrong term, acknowledging that we need to start thinking about things in the categories that they are.
Well, thank you very much. I'm going to open it up to the audience, see if there are any questions from both the live audience and the Q&A. And by the way, we're on LinkedIn Live. So everybody out there on LinkedIn, hi, hope you're watching this. Okay, we have one from the live audience and several from...
Sure, we do. Hi, I'm Emily from Columbia University. First, just wanted to say thank you for using this platform to shed some light on the topic of women's health. I think it's really important. We're certainly grateful for that. You talked a little bit about places where the market seems ready for solutions to some of these challenges, and especially with devices like the speculum that haven't changed fundamentally in a century. It seems like it should be ready. But you also talked a little bit about where it may not be ready for reasons like reimbursement models or policy challenges. Could you talk a little bit more about how you see the market breaking down into one of those two buckets? And in cases where you feel the market is not ready, what role do you think of Deerfield or as investors playing in affecting policy in that landscape?
I think a lot of women's health, because it's a very broad, women's health, falls in the non-life-threatening conditions, right? And I think it's almost a quality of life or experience. And I think that we're not seeing reimbursement for that, because we don't have enough studies that illustrate the value of that, whether it's mental health value, quality of life value. And so we haven't done a large study on the pain impact of the current speculums or the deterrence of women to get physical exams because of the speculum. And these are very expensive, long-term studies that probably have to be funded by public funding or donations or some other sort. And so, how do we get those studies done to provide real, tangible evidence that these are important new devices or instruments that we should be having? And that's the category that I find the hardest to get funding for. Breast cancer, cervical cancer, ovarian cancer, and those are also women's health, but frankly, I think a lot of attention, should be and have been on it, but it's really the non-life-threatening conditions. Fecal incontinence, for example, urinary incontinence, things that are lifestyle that blamed on just getting older. It's an embarrassment factor, right? But it's a quality of life, and and we're now seeing a lot more reimbursement for neurostimulation and of those sorts for those kind of conditions. But that took dedicated research, and we had key stakeholders there who had a benefit in demonstrating that. And so there's I think we need to think about how do we create the evidence that we need to get these different products more accepted.
One more from the audience, and then we'll take a couple questions from here.
Thank you. My name is Wilson. By the way, I'm practicing natu for Indian culture, so I'll be ready in a few months, maybe years. NASDAQ just moved a new ruling that at least one woman or gender diversity and one minority should be included in the board. So that's, I think, the positive way of encouraging that, and maybe the stock exchange, New York Stock Exchange, might follow that. So it's a good start. My question is in terms of people complaining, companies complaining about stagnated dynamism, business dynamism, and productivity, and making women uncomfortable and letting them go at their prime is, I think, one cause of that unproductivity or decline in productivity. And my question is related to that concept and the brain drain and the Republican states stopping reproductive health and abortion rights, and recently about the abortion pill in Texas, there was something. And I think that would lead the educated women to leave the states and even their partners, so it's had a double effect. So what do you think will be the trend? Do you think women in those states will be forced to leave those states, especially the educated ones, where they can find safe havens in terms of their reproductive rights?
One thing about brain fog and menopause, the impact of menopause on brain fog is actually the same impact that chemo for breast cancer has on brain fog. Because the same estrogen impact, Hence why I use the word clinical, because you actually see the same impact in true, sorry.
That's okay, take your time.
I have one more thing of water.
Please go for it.
Thank you. I think in terms of, I think the productivity issue, for example, let's bring it down to the facts and why it happens, and we can show that it's a real, I guess deals with hormones, I'm so sorry.
No, I think where you're leading up to, right, is...
Excuse me, I didn't say brain fog, I said brain drain.
Oh,
I'm sorry,
okay.
I don't want to confuse those
No,
things.
no problem. I think that the issue of brain drain in those states, it's hard to assume that people would just leave because people have sometimes families or roots, and so I don't think we have enough evidence to see what the impact will be over the next few years. I think something that we're watching, and the advocacy groups aren't giving up in those states. So I think we just have to kind of figure out how the impact's going to be.
And it depends also on the stage of life you're in. So I think, like you said with the other question, we need, more data, and we need to watch and see what happens there. Which brings me to, because the brain drain itself is a huge issue in terms of just, as you mentioned, half the population in this world are women, and so the moment we lose, sure, you can have this water too.
I'm sorry. It's the spring.
Do you need a lozenge?
Thank you.
That's the sort of the side effect of having young children, is that they
bring in
home like some
plague every day. Yes,
every day. They're walking petri dishes sometimes. Yes. So, but thank you for joining us despite having a little cough and cold.
Yes.
So thank you for doing this. While you actually get your throat back,
thank you.
One of the things I just wanted to comment on is that the brain drain is a big issue, just regardless of what the reasons might be for women leaving the workforce, partly due to medical conditions, partly due to just not being able to, having to choose and making priorities, but also because, there is sometimes a price to pay. And so women sometimes choose actually to leave. And that's why you see the leaky pipeline, where there comes a stage where the number of women entering the workforce is high, but then it gets to a specific point and then it starts dropping, and that's the leaky bucket, leaky pipeline syndrome. Which actually, just to pick up on the previous question from the audience, there is, do you have any advice for women entrepreneurs in the current market environment? What should they do? And any specific areas, where there seems to be promise for women entrepreneurs too?
So I think women entrepreneurs, if I'm thinking about a male, and again, apologies about the cough-induced tears. I think that think of a male CEO and a female CEO coming to pitch for a company, the confidence that the male CEO has, I wish the female CEOs had. The male CEOs tend to dream bigger. They ask for bigger checks. Women tend to ask for what they need. They budget. They do their homework and they ask for what they need. Like, ask for more because things go wrong. So I would say, go with confidence. You earn the spot that you're in. Don't be afraid to ask for more than you need. And I think that you have to expect that if it's a women's health company, you're going to have to do some education. And so think about how you want to educate and think about how you want to have that messaging and how it be most impactful. Maybe practice it with some folks. But I think incorporating education into your pitch is really, really important. And also, sometimes it helps if you can see if there's a woman on the team who can be an advocate for the condition. So those would be my 2 points.
And one piece of advice that another woman leader gives to her mentees is that what's the worst that can happen if you ask?
They say no.
They say no.
Yeah.
What's
Sorry.
the best that can happen?
They say yes.
They say yes. And so part of that. Work-life balance.
I don't balance work life. I just live it. Like you just kind of are able to. I think I ask for help when I need it. And I have the ability to ask for help. I know for a lot of women that's not an option. And so I don't underestimate or undervalue that. But I think the idea that we have to balance is not. I never feel balanced. I always feel a little tired. But I think the key is you need to know when you need to ask for help, and you need to know when you need to stop doing too much.
Yeah. And balance assumes that it's a zero-sum game, and it's not.
It's not. And some days I'm a mom more, and some days I'm an employee more.
Yeah.
And that's just how it is. Yeah.
That's how it is. Let's see. We are at time. We'll do one last question, and then let me see if there's anybody in the audience who has a question. Yes.
I was going to ask about back to the investment question from earlier. When a woman is coming to pitch, aside from the confidence, what are some key bullet points that you're looking for a woman entrepreneur that's looking to innovate in women's health? What are some key? Are they looking for more facts, some more government support? What are you looking for from the background?
I mean, I personally don't look for different things between men and women. I think that we're just seeing more like different trends than what men and women tend to bring to the presentations. And so I think part of it is that I've had multiple male CEOs say I'm the next Elon Musk. I've never had a woman CEO come to me and say I'm the next Elon Musk. So I want that confidence, and so I think part of it is, I have had multiple CEOs say it to me, and I'm like, that's great, because if you missed, you're probably somewhere still up there. That's really great. So I think come with the confidence, come with the education, and I think the other key trend that I see that's different is the modeling and the forecasting, and that's where I almost see too much detail from the women. I'm like, okay, we're going to spend $2 million and 0.98 cents. I'm like, you don't need to be that specific. Like, be able to model it out in a way that allows for things that can go wrong, things that cost more money. And so I think giving both those two things, one, more confidence, and two, better methods of portraying the model and the forecasting needs.
Yeah.
Fast.
Yeah.
Thank you. You've both been really incredible, and this has been both informative and really funny, so thank you. Just quickly, do you think that there needs to be any consideration for perimenopause in the workplace, sensitivity and thinking about that? I just think of it as slightly a bridge to conversate leading up to menopause and some other issues, so just curious on thoughts.
I actually lump perimenopause with menopause because some women's perimenopausal symptoms are worse than other women's menopausal symptoms. And women have different times between perimenopause and menopause. And you can have chemo-induced, for example, perimenopause and menopause. So I personally lump it all into one category.
And last question, we can't leave this unaddressed, so we'll just close with this one. How can we help advance healthcare parity for women?
I think we need to make investments. I think we need to, again, be willing to be educated about what we don't think is a problem actually is a problem and write a check for it.
Yes.
The only reason now we're seeing lots of menopausal solutions is because people are willing to write checks.
Yes.
And some of them were celebrity females who took that initiative and called the gold rush, they're calling it these days.
Yeah.
And so in order to advance, we need to be willing to invest in it. It takes time.
It takes time,
Yeah.
yes. I think, and investing in women is a great return on that investment because, again, it's productivity in the workforce, it's, stemming of the brain drain, it's so many different things. And in addition, I think that, one of the other quotes, famous quotes that I remember from, wonderful women like you that I've had the opportunity to interview is, let's stop fixing the woman, let's fix the system, right? And so I will leave us with that quote, and thank you all very much for coming, and really appreciate your engagement.